You're listening to ParentMD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. Welcome to ParentMD. Today we have with us a special guest, Keili Mistovich. I believe I said that correct.
You did,
right?
yes.
All right. Well, glad you're here. Keili, if you would, give a little bit about your background, and then we'll jump in our conversation.
Absolutely. So I am a general pediatrician. I practice medicine in Cleveland, Ohio, and I traditionally came from a traditional outpatient pediatric practice. And then about 2.5 years ago, I left that and started a direct pediatric care practice. And that has been going wonderfully, so much so that we decided to expand that. And we are beginning to form the first direct pediatric care network in the country.
Excellent. So obviously that bit of background is what I want us to probably spend a lot of time on today, because I think parents need to understand that model. It doesn't mean that model is better, trumps, replaces others. I think what we're doing is just getting more options for families based on whatever their needs and desires are. And I'm so excited to talk about that more. And it's been a learning process for me as well. Keili, you also are married to a pediatric orthopedic surgeon.
I am indeed.
and I think it'd be neat for the audience to hear a little bit about, how that enhances or challenges your practice. And of course, got to meet Justin, and we're going to have him on for a podcast too, because I want to hear his perspective. But I just love how engaged he is with you on this journey of setting up Zest with Dr. Hertz and the team that you're doing. And what I love is the energy and the vision that you all have. And my takeaway, it's a vision to make things better, more accessible, enhance the practice for the pediatrician, which ultimately plays over to improve the experience and access probably for the parent. In a nutshell, it's about seeing fewer patients to be able to spend more time, and we to know time is needed. And that's a big piece that ParentMD is trying to solve, is be an adjunct, a partner to the medical home to help expand time for pediatricians who recommend us as a resource when they can't spend all the time in the education component. And if they need time with another provider, then there's the telehealth resources. And so this is all about enhancing access and time and being trusted partners. And of course, I see you all as definitely a trusted partner for parents and ParentMD. So we'll talk a little bit about all those things today.
Sounds
so
good.
Let's come back. What is direct primary care? You use the word traditional. You come from a traditional setting. So let's talk about how we might define traditional, and then talk about DPC, compare and contrast, and then we'll kind of go from there.
Sure. So in my mind, a traditional practice is one that is an insurance-based model where the insurers are kind of in charge of the payment model for that system, and thus everything that pediatricians need to do kind of has to fit under that, under those guidelines. And so what that means for a traditional pediatrician in that office is that they are seeing many patients a day. They have large panels, usually somewhere on the order of 2,000 to 3,000 patients per pediatrician, which is a very large number.
And that's very average. That number is average around the country.
Absolutely. And that means, in order to take care of that many patients, it means that you're seeing 20, 30 patients a day, in part just, because there's many patients that need care. And so you're seeing them for that reason. Then also, in order to kind of make the whole model work, you have to see that number of patients in a day. And so, so for pediatricians, there's a lot of, there is some goodness in that, right? It's good to be able to see a lot of, you get trends in the community, you understand what's happening. You're able to, touch the lives of many people. But it's also extremely busy and difficult. And, I think for many of us, it makes us feel like we are not quite doing the jobs that we really want to do. We often use this term called moral injury, where it's not that doctors are burnt out. We expect to work hard. You go into medicine knowing that it's going to be a tough job, and that's part of it. It's not so much that. It's really that you can't do the job that you want to be able to do. And that's really where the pain comes, and that's where the quote unquote burnout comes from.
Yeah. You leave each encounter, if you couldn't scratch the itch, it kind of reminds me of the don't know if you ever watched Big Bang Theory, but Sheldon, he needs closure on everything. And so they had this one episode, they were trying to desensitize him, and they were playing tic-tac-toe, and they wouldn't let him finish it. They played, I think, the anthem. They wouldn't finish it, and the Jack in the Box. He just couldn't stand not finishing it. And as a physician, when you're taking care of a patient, if you know there's more you need to say and do, and you know the parents have questions, but you are limited by the time slot and the next 3 rooms that are already full, you're just always kind of left hanging for yourself, and I would say a lot for the parents. Now, that doesn't mean great pediatricians don't get very efficient and I would say take care of most of the needs in a very efficient, effective way. And probably most of the parents most of the time feel like, well, I got what I needed. But truth be told, all pediatricians would like to spend more time with each patient, and parents would like more time with the doctors. I don't know anybody that would deny that.
Right.
And then it's a game of just numbers. You have only so many hours a day in sleep. You have so many hours for personal life, and then you have so many days in the office. And if you are squeezing in a panel of 3,000 patients, you're going to probably have 22, 25 patients to 30 patients a day in an 8-hour, 9-hour day, and sometimes more. It's only so many minutes per patient counter. The other piece is that at the end of the day, it's not just always about choice, and you mentioned that too. It's the necessity to meet the needs of communities. Every community cannot have enough pediatricians usually to do less than 2,000 to 3,000. And we know that our population is growing. The med schools are only cranking out so many number of pediatricians. So actually, it's getting tighter and tighter by that very nature. And then the insurance model, how it is for pediatricians to make the income that they look to make as professionals with the decade they gave up of sacrificing to be educated in that regard, and then the money they pay in debt to get through that process, and the money it takes often to be in a practice and get started. If you look at what their desire is for just a return on that investment, that education, they have to bring in X amount of volume, which means X number of visits, and based on the insurance model, the insurance guys set what payment you get. And we all know that's been ratcheted back. We all know cost of care is going up. Hence the other trend that we've seen in our country, definitely first with the adult primary care world, is being employed by large practices and large groups. So you can control those costs and hopefully have more margin so the providers can make more of what they thought they would make, because all that's gotten really ratcheted back through the years. Not that all doctors don't do well and make plenty. So a lot of pressures in that world. Talk to me about how happy you are in your current state in the way you're practicing now, and how that does vary from the traditional.
So I often, when I'm talking to other doctors about this and what my life is like now, I will often say, you could not pay me enough to go back to practice the other way. And the reason I say that is because there is so much, I have such better kind of life-work balance. I'm able to truly spend the time and be with my patients in the way that I always felt like I would be as a pediatrician. I think we go in kind of with this idealistic mindset of what we want to be able to do. And now I actually feel like I can do it. I have all of those. I have enough hours in the day. I have few enough patients that I can give them all of my energy and my time and be present with them when I'm in a visit with them. I'm not thinking about the 3 people that are waiting in the rooms down the hallway for me to do. I am with that patient until I am done, until they have no other questions that they want to ask me. And I feel like we've really gotten that closure and kind of, at the very least, have a plan of what we're going to do next.
So with that, as you mentioned last night, the way that looks is you can have about an hour for a checkup as needed. But what also I heard in the conversation last night over dinner with the group was that you've got better work-life balance, but you're actually having more time dedicated to your patients, meaning evenings, after hours, going to home visits. You've kind of expanded yourself more, but it's not as intense, so you can be there for a fewer folks and do it. So even though you've expanded probably your hours you're on call for your patients in practice, it sounds like, and doing home visits, it sounds like it's still a better balance, more enjoyable, because you're getting to do what you feel like you can do to the fullest.
Absolutely.
Right?
Absolutely. And, I think there's also a level of autonomy that comes with, owning the practice myself and being able to instead of being dictated by the insurance companies of how and when I need to see people, I can choose to, I work with the families and we choose, what's the best time for you and me to be able to come in. And that time might be 7 a.m. or maybe it's 6 p.m. And so there's so much flexibility in what does that look like. And if I need to, say my daughter has an event at school, I can just go to that and schedule around it. And it's not an issue. So it allows me to also be present for her and to be a mom, as well as being a pediatrician, which is a blessing.
And you still have one other partner that can cover it for you in the event you're out of town and life gets in the way and you need some coverage. And so you cover each other. But it sounds like even on your administrative days off, you're still covering and meeting the needs of your patients and you're enjoying doing it, right?
Right. Absolutely. It's a very different thing when you have families that I know them, I know the kids, I know the pets, I know the names of the stuffed animals. Like I truly know everything about those kids. And so when they send me a text message, it's almost as like it's a good friend of mine or my sister who's sending me a message and asking a question about the kids. I don't have to open my computer and go through the chart and try to figure out like, who is this kid again? Like what's wrong with them? Do they have asthma? What meds are they taking? Like there's none of that. I just know it in my brain and I can just respond to them really conveniently. And it's great for the families. They get their questions answered super timely. And I'm able to, I know that I can take care of them and I'm doing a good job.
So they have your number and can text you and you can communicate via text, right?
Exactly.
I'm sure a lot of parents would love that kind of access. The other thing, now let's bring this perspective, it's always about numbers versus 3,000 or 2,000 or 2,500. We're a tenth of that, 250. Is your planned panel. Is that correct?
Correct. Yep. Yeah. So very different numbers.
Yeah.
Very different.
So how do parents feel about it?
They love it. I don't think, we actually surveyed them about a year into opening and asked them, what can we do better? What do you love about this? What is, whatever. And everyone was just like overjoyed. They often say they feel like I am part of their family, that I'm truly like, I know their kids. I care about them. I am there. I had a family tell me the other day that I'm their lifeline. I'm just able to be available for them. And they love the convenience. They love the accessibility. They love the relationship. All of those pieces that just make them feel like they're truly like giving their kids like the best care that they can get.
So I can, because of our conversation last night and just knowing how this works and all the things you said, I want to package another piece here. You not only are able to enhance the clinical care that pediatricians traditionally give, the vaccines, the test, the looking at an acute problem or managing chronic disease. As a pediatrician, it's so much more. It's about development. It's about behavioral health. It's about mental health. It's about emotional well-being. It's about the family dynamic. It's about parenting. It's about parent coaching. It's about working through all those things that markedly impact the health of the family, even though it's not what we've always deemed as clinical organic health, which the pediatrician largely focused on. Even though pediatricians definitely get in the weeds on all these other things, it's kind of hard, though, when the very first priority is always keeping everybody alive, diagnosing a problem, and doing what you have to do. The others are usually kind of leftovers as they get the attention as needed. And honestly, when we were trained in medical school and residency, those other things you learn from your mentors and your own experiences. And I'll be honest, I feel like I learned a lot from my parents. Parents and senior mentors. And then later just being a parent is what probably taught me a lot more. I wish I knew now what I knew back then, as we always say, which is another reason for this podcast is I want other pediatricians to learn from your experience. I want parents to understand how you see the world, how you're thinking, and how we want. And what's fun for me is seeing you light up saying, I'm part of their family. We're pediatricians so much want to be valued, respected by the parents we serve. That's what fills our cup, right?
Sure.
So it's not just about making that child healthy, which that's plenty and enough. But when you see the whole family unit functioning and happy, and they feel like you contributed, and you're part of that, that's just the icing on top of the cake for the pediatrician, don't you think?
Oh, absolutely. We like to talk about how we can it's a whole child care. It's not just what you said. It's, kind of checking some of those boxes and let's make sure you're alive and healthy. But there's just so much more to it. And now that I'm, practicing medicine this way, I can actually have all those conversations. We can talk about all of their development. We can talk about what's happening with the family. We can talk about what's happening outside the family and school and all of the things. And sometimes parents will say to me, like, can I ask you this question? Yes, you can ask me any question about anything that has to do with your child, like, or even not.
How do you think this is going to impact as that relationship enhances? How do you think when that child becomes a teenager, will you actually have more likelihood to be at the table to impact their lives and hear things that you might not otherwise when you have one-on-one, and them feel you as a trusted member of their family to share when maybe they came to their parents? I just can't imagine that this isn't going to also expand that partnership and relationship, which is so key in those teenage years.
Yeah, absolutely. And I'm already seeing that now. I have some families who, you know, certainly the largest chunk of our practice is kids, toddlers, and, you know, early elementary school kids, when parents feel they have the most questions, that they realize they have the most questions at that point in time. And so we have a large chunk of that. However, I do have some families who have specifically brought their older kids to me because it's very important to them that their kids have a relationship with a doctor who they can trust. And so I am able to have these, you know, really insightful and in-depth conversations with these adolescents because they have built trust in me over time. And they see me as someone who, one, I'm not going to automatically just run to their parents and tell them all the things. And they feel like they can tell me what they need to. And I know them, that I can ask the questions that someone who hasn't met them before is never going to be able to know what to ask. And those kids, certainly, it's hard enough to get a teenager to open up about anything. So to have that sort of relationship where they will like seek you out to tell you what's like, you know, simmering in their brain, it's going to be, you know, I see it as a huge life-changing trajectory.
Yeah. If you were just to whiteboard this out, and I like whiteboards, I would be saying everything is about, it starts with time. And when you have time, you can have relationships. And when you have relationships, then you can have trust. When you have trust, then you can expand on quality and service and experience. And that's what enhances the relationship. And so it's a great cycle, but we can never dismiss the value of time. And it goes back to parenting too. You can say, I can be well-intentioned, I can have plenty of resources, I can do a lot of the right things, but if you don't have time with your kids need time.
They do.
Your spouse needs time. Your friendships need time. And so time is the crux, and I feel like you're all solving for time more than anything, which then has a trickle-down effect.
Absolutely.
You know, if you think about it, I always say when I was in the healthcare system, the biggest thing that we were selling in healthcare and marketing to customers, the patients in the community, were slots of time. So I said we had to manage those slots of time because each provider, doctor, nurse practitioner, only has so many slots of time. And that's why we had the access center to get people in at the right time, because you want them in the right place and having the right doctor for their need. But time's the very first thing you're managing. And also, if you don't have enough time for your patients, you talked about burnout. And for a lot of doctors, it isn't about burnout. But I would say for a lot of doctors today, it is about burnout too. They are literally burnout. We know many of them. It's because they're not having time to do everything they need to do to actually take care of themselves and the balance of life.
Absolutely.
And a lot of folks aren't seeing, knowing. That's in the conversation, talk about it other times too, is I want people to realize that there's that moral injury with the physicians when they're run ragged, but they literally get burnt out and they don't enjoy, and they're not as, their cup's not filled as much as used to because they're honestly not meeting their basic needs, in my opinion. And they're on a hamster wheel.
Yeah. Yes.
And I always say it this way, and I don't mean to take away, but you're making widgets. Definitely for the insurance company, they see you as a widget maker. And that's hard, and that's a little bit demoralizing for a clinician who's a professional, who's wanting to have experience, and they see this as an art, but then someone puts them on a hamster wheel to do a whole lot. And nobody intends to do that. It's just the nature of the beast in business today and what healthcare has kind of turned into. And I love that. I think you're all disrupting that and providing another option. Not that the other options can't work and don't work well in some places. And again, I'll do another plug. To me, those worlds can work well when administration and the physicians have a relationship and they work that out to make sure there are plenty of resources, because you can do a whole lot with a lot of resources. And when you're valued and respected and at the table to help impact your world, a lot of doctors don't mind and can very well see a whole lot of patients. But at the end of the day, they still don't have enough, and this model gets that. One of the things that I talk about, the different topics you can talk about that you might not traditionally in a traditional office is somebody, I think it was Dr. Hurst, mentioned talking about your kids about how to play with them.
Right. Yeah.
Okay. Well, you don't traditionally think you're going to have time to talk about such, but when you can talk about play and understand, talk even more about how your kids interacting with friends and one another, you're getting down into what's really important to help that kid and the family unit thrive.
Yes, absolutely.
So, yeah.
I was going to say, one of the things that, we with the Zest Network want to do is kind of develop a new curriculum of like, how do we, what is it that parents need to be hearing from their pediatricians? And there's so much that they don't even realize that they could be learning about and talking about. And how can I be proactive in my child's development to make sure that they are, they're doing, and I'm tending to all of the things that they need to be doing, whether it be playing with their kid, how are we reading to our kids? What do you do for tummy time? Like, what actually is that? It's not just do it. There's a very specific way to do it to really optimize what that looks like. And, or financial planning for your kid. Like, who talks about, like setting up their college fund? No one. And so parents just kind of have
how
to
bring
figure this
kids
stuff
along
out.
in the financial maturation.
So there's a whole curriculum of things that pediatricians could be, once they're also trained in, and how do we talk about that, then to give that to families. And when you have the time to do that and you have an ability to have these extra appointments, one of the things that I have always thought was crazy was that kids are seen once a year. Like, after they're 3 years old, they're seen once a year by their pediatrician. Right. Like, they're not the same kid from 4 to 5 or 5 to 6. And there's so many touch points in there that, like, of what they need and how their development is changing and the different things that you can and should be talking about, that just doesn't happen in the traditional model.
True. And in this curriculum you talk about, I love it. It's everything, again, that you want and think parents should know. And there are a lot of those pieces and parts all around out there. But just for the audience to know, what we've talked about is, how do we build this curriculum together? Mm-hmm. How does ParentMD, with our vision, our platform, and what we're wanting to do, and while you're seeing patients, but you can let us know what you think, how can we work together to do that? So to me, I think that's going to be a really fun project. I don't doubt we'll end up doing that together, because that's the thing. I want to pull all these things together in a trusted fashion from pediatricians like you who are living and breathing it every day, seeing the patients. You have your finger on the pulse of what parents want and need. And then how can we sit and be a good partner and get it to parents in an efficient manner?
Absolutely.
So to me, that'll be fun, exciting. That was a conversation our team had last night, even after the dinner, talking to you guys. And I was telling my wife, Michelle, about this morning. I just love connecting to other partners where we are aligned on the mission to take care of the patient. Mm-hmm. And then, but we get the business side and we know what we have to do to deliver. And then if we do it in an efficient manner that parents are like, I want that, that's great, that's better than anything else out there, to me, that's rewarding. So I'm really looking forward to the collaboration and partnership discussions we're going to have. As we get close here in a little bit to wrapping up, I'd like to ask you a few other just kind of random questions about your practice. And what I like parents to hear are what things you want parents to know, what lessons you've learned, what you think can be great for them as parents, and how you can help them. So just kind of open mic time. What would you like to share to parents that you want them to know, or little pearls of wisdom?
Great questions. So I think one piece, and we've touched on this a little bit, is that there are options, and that there is, just that this model exists. I think that for so many people, they don't even know that that's a choice, and they don't even know to look for it. They don't know what it's supposed to be and what that kind of a relationship could be. And so I think one thing is just to make the awareness of the
different models in your community.
Yeah.
Right.
Right. And so, and I think the other,
And how do they get informed on the different models? I mean, that's going to be another conversation for us in the future, is how do you pick a pediatrician? Mm-hmm. And we're going to do some videos and conversation on that. So how do parents do the research?
That is tricky. That is tricky. And I don't know if I have a great answer for that. I think some of it is, is listening to these types of podcasts where we try, and, folks like yourself try to kind of put that out there so that parents can be educated in different mediums that they're able to hear and listen to and read. And so the more that we talk about it, this is, in pediatrics, this is an emerging option. And it exists in the adult world. It has for a long time, but in peds, it's really new. And so we're trying to get the voice out. We're trying to talk to the American Academy of Pediatrics and all of the organizations and people that...
And you all actually wrote up something, if I recall, for the AAPD recently, because they wanted to hear you all explain so pediatricians and parents knew about this option. So you have partnerships and people trying to educate and increase awareness.
Absolutely. And even from a pediatrician standpoint, there's so many, especially new residents, that have never heard of this, don't even know that it's an option, don't know that if I go into pediatrics, this is something that I could choose to do. And so that's the other piece of the education is, we have, where I went to medical school in Pittsburgh, we've talked to them about doing, having talks and giving presentations to their residents to know, and to their medical school to know that that's something they could think about. And so we are, we're actively trying to find all of our partners and people that we can kind of, start to get the voice out and really make it known of other options that people have.
That's great. From a day-to-day, just practical perspective, what advice do you have for parents? Do you have a couple things that are recurrent themes that you feel you could package right now into one or two bits of advice?
I think it's important for parents to know that they know their kids the best. And I think parents undersell themselves, and I think they don't, give themselves enough credit for what it is that they do know about being a parent and how to be a parent, and certainly their kids, right? There's a lot that you can learn. And so finding a pediatrician that you can partner with who is able to meet you where you are, who understands your goals as a parent, and to be able to kind of talk you through and help you through all of those things. But at the end of the day, it's still your child and you still know them best. And I think you need to trust yourself as you're, in all of the decisions that you're making, that you are going to take good care of your kid.
Yeah, I love that. That comes back to conversation I had with Mick Connors the other day, who's a pediatric ER doctor. And we were talking about utilization of the ER and such. And we always said, and you want to highlight, you know your kid the best. And if you're worried about them and you feel like you need to go to the ER, go to the ER. And whatever it is, you need to do what's best for your kid. And to me, the pediatrician who is doing what they need to do for family, they're sitting there as what you were describing a different way, as a partnership. Mm-hmm. As a pediatrician, you're there saying, my job is to inform, support, help you make informed decisions, not force a decision on you, but help guide you in the way you want. And oh, by the way, you really do need to click and fit and feel a connection, so much so that, to me, the desired outcome is that you as a pediatrician and that parent feels that you're part of their family. Mm-hmm. That's the ultimate. If you ever get to that point, then you're practicing great medicine and families are getting what they need. Okay, so I love that one. Give me something else, one more that you want parents to know. But I love that, empowering them, that how they know what's best for their kid, and giving them the credit that they don't have to have all the medicine, but they do know their child. And no one knows the child like a mother. We'll put dads right there too, but it's usually moms, and dads. Some dads come along and get close, but nothing like the mother. So what else would you tell mothers and fathers?
I think it's important for them also to understand that being a parent is really hard, and that it's okay to make mistakes, and it's okay to apologize to your kids. And I think that parents don't necessarily feel like there's like this level of guilt that if you know that you've done something wrong, but you don't know how to fix it. And the power of an apology to a child is, it's immense. It means the world to them, and to know that their parent is human and they can make mistakes too. It's such a teaching moment, and it allows the parent to grow and allows those kids to grow.
Oh, that's great. And I would add on that, I would expand only to say that because you're going to make mistakes and because you don't know everything, just surround yourself with people you trust, people who've been there, done that, and gather a lot of folks' input, and you don't have to take everybody's. I mean, you're going to have your pediatrician, you're probably going to have a nurse with them, you're going to have your parents, you're going to have your siblings, you're going to have other friends and family. Mm-hmm. And gathering, knowing it takes a village to raise a kid. The other thing I would add in that I always valued, and I heard it early on, I think it's great for your kids to have other parent figures that they see as co-parents, whether it's godparents or not formally, but just to have other parents that those kids can look at different styles, know they have other people to go to. Mm-hmm. Me and a couple of buddies of mine, we have a farm together, and we've each got kids. And we grew up and we talked often early on, 16 years ago when we came together, that we wanted our kids to feel like they could go to any of us as dads and be another surrogate dad. And so we talked about that a lot through the years. And we truly I love when my boys feel like they really connect with another father or another set of parents, because they need to learn. And sometimes I'm not there to meet their needs. I finally learned at this age, my two boys, 25 and 22, there are other people who can meet some of those needs as young men for them better than me. And I want them to have all those people around them, mentors, friends, people they can trust and talk about different things. So yeah, I think that's key. We don't have all the answers and we can lean on others, but boy, the power of an apology, I love that. So a couple of great pearls. Thanks for your time today. Really enjoyed you and Justin and Drew being with us over the weekend and our conversations together. And I look forward to us doing more conversations like these. And I look forward to putting together video content of things that we think parents need to see. And I totally see you sitting here packaging information to parents, and hopefully we can do that together and see ParentMD and Zest be just one of those many, many partnerships that we foster through the years that I think are great for parents. So appreciate you being here.
Absolutely. Thank you so much. We look forward to it.
Thank you.